Good afternoon, everyone. Let me introduce my PhD topic in mobile motion analysis system. My name is Azamat Bissenov. I'm a medical doctor from Kazakhstan. My vision is high-quality health-conscious behavior and personalized medical care for disabled people. To pursue of this vision, my mission is clear: to promote widespread use of mobile motion analysis system for easier diagnosis and a more accurate treatment of musculoskeletal disorders. There are two specific goals related to my PhD topic. Today, we will talk about first two. My first project is called Investigating the Validity of Inertial Measurement Units on Gait Parameters in Ambulatory Individuals. The gait, the ability to walk, is a fundamental aspect of human being. It's not just means of getting from one place to another. It's complex motor function that involves coordination of multiple body systems. It's important for maintaining independence, mobility, and the overall quality of life. And the impairment of gait is particularly common in several diseases, such as osteoarthritis, cerebral palsy, and the stroke survivors. And the gold standard to assess gait parameters nowadays is 3D motion analysis system, which is known for its accuracy and the reliability, but usually come with higher costs and the technical complexities. But in technological advancement age, alternative system exists. This is inertial measurement units, which is characterized by lower cost, the ability to be used in non-hospital settings, which makes it more accessible. My aim to evaluate the validity of inertial measurement units for motion tracking. In this picture, you can clearly see this both system. 3D motion analysis system requires dedicated place with specialized camera setup, and the calibration process is complicated. But inertial measurement units is user-friendly. You can assess gait parameters by using some sensors and the mobile phone. From this, my clinical question comes out. Does EMU have clinical acceptable validity in measuring gait parameters? My population, ambulatory individuals, it might be healthy or volunteers, index test inertial measurement units, reference test 3D motion analysis system, diagnosis of interest, gait parameters. Our hypothesis, EMO technology demonstrates comparable validity in capturing gait parameters. If our hypothesis is true, we improve accessibility to motion analysis system for wider range of population. We conducted our systematic search in 4 databases in 25th of November 2023 by using these 4 domains. We found approximately 15,000 hints. By narrowing it down, 25 full text has been selected. We are interested in gait parameters, particularly in gait kinetics and the kinematic parameters. Our outcome measure root mean square error, which is important in biomechanical studies, which usually show difference between these both systems. In this case, root mean square error show difference between EMO and the 3D motion analysis system. Higher root mean square error indicates less accuracy. Lower root mean square error indicates better accuracy. So in this picture, you can see our preliminary results. Outcome ankle joint angle in sagittal plane. Outcome measure root mean square error in the same units such as joint angle. Heterogeneity is little bit high because of different models of EMO and the calculation used in these studies. Pooled root mean square error 4.59, which is less than our threshold 7. Our second outcome, knee joint angle in sagittal plane, also outcome measure root mean square error in the same units. Heterogeneity is high, as I previously mentioned, because of different models of EMO. Pooled root mean square error 5.15, which is also less than threshold. Our last outcome, preliminary hip joint angle in sagittal plane, pooled root mean square error 6.49, which is also less than 7. But in this forest plot, you can see difference between studies, because hip joint is complex joint than knee and the ankle. Also, because of more soft tissue, it makes some errors. The strength of our project is first meta-analysis for gait kinetics. Also, we followed strict methodology, and we hope we didn't miss any relevant articles. There are some limitation as well in consistent methodology in articles, also high heterogeneity. In conclusion, from our preliminary results, EMU-based gait analysis system has shown results within reasonable limits. Implication for practice, it allows for clinicians where a 3D motion analysis system is unaffordable to perform gait analysis for their patients. Also, they allow them to monitor gait patterns in a real-world environment, in non-laboratory environment. Implication for research, additional research into the accuracy of EMU models and their application on different patient population is needed. This is progress from our first project. The risk of bias assessment is finalized. We are working with our figures and the tables. My second project is called Investigating of the Efficacy of Contrast-Induced Movement Therapy for Gait Improvement in Children with Cerebral Palsy. Cerebral palsy is the most common motor disability in childhood by affecting 23 per 1,000 live births in the worldwide. Cerebral palsy is characterized by a spectrum of symptoms, among which gait impairments particularly common by affecting 97% of individuals. One of the rehabilitation approach for this patient, contrast-induced movement therapy. By restricting the use of affected limbs, we encourage the use of affected limbs, which has shown promise in improving upper limb function, but its potential effectiveness in lower limb remains of area of exploration. Our aim to evaluate the effectiveness of contrast-induced movement therapy and enhanced gait parameters in children with cerebral palsy. Our clinical question, does constraint-induced movement therapy effectively improve gait parameters in children with cerebral palsy? Our population, children with cerebral palsy, intervention, contrast-induced movement therapy, comparison, standard therapy or no intervention, outcome, gait parameters. Our hypothesis, CIMT, the best therapy option, improving gait parameters in children with cerebral palsy. If our hypothesis is true, we improve one of the treatment methods for this population. Our preliminary research conducted in 3 databases. We are still in the first stage in this project. In summary, we hope that we finalized our first project in May 2024 and the second project in September 2024. In conclusion, I would like to say thank you for attention and finalize my presentation with Hippocrates' quote, "Walking is the man's best medicine." Thank you.
So my first question is actually, the 3D motion analysis seems to be quite different from the intervention.
Inertial measurement units.
Yes, the IMU. Are there any additional measurements that can be done with the 3D motion analysis that cannot be done with the IMU?
There are a lot, because joint angle we cannot directly assess by EIMU. With 3D motion analysis system, you can assess all gait kinetics in the kinematics, but with EIMU you can assess only acceleration and angular velocity in the direction of movement. For other parameters, we should calculate from getting these parameters. By using body mass and acceleration, we can found kinetics and the kinematic results.
So the IMU would not really be able to replace the 3D?
Yeah, not fully.
Just for the gait parameters?
Yes.
Thank you.
Just for some gait parameters.
Okay, thank you for this nice presentation. I can agree with your last sentence extremely, because walking is very important and it's a treatment, because I'm a cardiologist and angiologist. My question is, do you have any pieces of data on the footwear or shoe, how it affects the gait parameter, gait pattern of a patient or a person? So if you have a barefoot patient with a barefoot or shoe or training shoe, it can affect the gait parameters as far as I think.
Yes, it can affect because of this. We usually recommend for different type of activities, different type of shoes. We can fix your ankle sometimes in sport activities. Yes, it might be.
I think it can affect not only the gait parameter, but other things like the problems of the vertebral column.
Yes, of course. For vertebral, for all joint biomechanics, it can affect.
I would like just to recommend your sentence that we have a clinical study about this project. And of course, we would like to standardize the EMU with the 3D motion capture system in healthy people, because you have true that barefoot and everything else problem can every kinetics and kinematics data changes. So because of that, we just started the validation. But yeah, you have true. It changes every sagittal plane and every data.
I have another question for you, Azamat, as well. Because in your second project, you say you compare this constraint-induced movement therapy to no intervention.
Standard therapy or intervention.
So is this constraint-induced movement therapy kind of like physical therapy, or it's more like physiotherapy?
It's physical therapy. But this second project is still raw. We are still working on this.
Okay, so you're not sure yet if you're comparing to no therapy.
Yes.